AI. And if you notice the cover for this year's journal, do you know who drew this picture? Which doctor? Yeah, this was drawn by Dr. AI. Yeah, so that should reflect our theme of this year. So it's my pleasure to introduce our next speaker, Dr. Pengfei Zhang. He is an associate professor in the Department of Neurology at Rutgers University. He completed his headache fellowship at NYU Langone Medical Center in 2017 and residency from Mount Sinai in 2016. His research interests include the applications of mathematical and data science techniques to clinical neurology and has published multiple articles on the subject in journals such as Headache, Fibromyalgia, Epilepsy and Behavior, and Frontiers in Neurology. He is also the author of several clinical support algorithms currently made available for public use at Rutgers University. Welcome, Dr. Zhang, to give us talk about AI in medicine.
Thank you for the kind introductions, and thank you for ACAP for inviting me to.
Is this better? Can you try it?
Hello? Better? Awesome. Thank you. I'm sure. Thanks for the kind introduction, and thank you for ACAP for allowing me to talk about a topic that is near and dear to my heart, which is AI in medicine. So here will be.
Click it, click it, click it. You got it? You go to that screen. There you go.
Here are my disclosures. Okay, so I have two goals in this talk. One is more objective, the other one is more subjective. The more objective one is really just to give a very simplified, very general overview about how a simple AI model is trained. I think Dr. Zhang will give us a more technical view later on. The second portion of this talk is more subjective, and it's really for me for us to try to understand the opportunities and limitations of AI in medicine. And the way I want to do that is actually just to provide some kind of context for this. So this talk is inspired by a podcast I heard before from the Slate magazine, together with economists, called "The Secret History of the Future." So what does it mean that it's the secret history of the future? Well, essentially what it is talking about, this podcast, which is now defunct, is now dead, but I encourage you all to listen to, is about how current phenomena are actually surprisingly similar to phenomena in the past. So, for example, one of the podcast things that they had was how online dating is actually surprisingly similar to dating in the era of telegraphs, or how podcast is surprisingly similar to the beginning of radio, and also how polar exploration in the Victorian era is actually surprisingly similar to space exploration in our current age. So again, I highly recommend it because I got this idea from it. Okay, but I guess that's the big question of this talk: is there a secret history of AI in medicine? So maybe before I do that, maybe we should just go back and think about the very, very, very brief history of AI, at least the way I look at it, and how that played out in history. I often show this graph. If you look at PubMed, if you look at the artificial intelligence of PubMed, you will notice that actually artificial intelligence as a concept has existed long before 2000s. Somewhere in the middle of that little trough there is when I graduated college in 2008. And when I finished my college in 2008, one of my good friends in that department decided to do a master's degree in machine learning at Penn. And at that time, I thought the guy was crazy because I think to myself, why would anybody in their right mind try to make machine learn anything? 2008. Well, a couple years later, actually 7 years later, I was pretty proven wrong, because that's when, I don't know if you remember this, when AlphaGo in 2015 first became the first algorithm to be able to beat a human player in the game Go. So, like computer program beating you in chess is kind of common and expected. But Go is a very different game. Go is actually done on a 19 by 19 grid. So you do that together, and then you start thinking about all the possible combinations in the Go board that quickly become astronomical. So, in 2008, I never thought anybody can write an algorithm to beat anybody in Go, but that soon became a reality. And that's when I started realizing, hey, something is happening that is not happening before. And that's something keep on happening in 2018, which is only 3 years later, when AlphaFold was invented. And AlphaFold, for those who may have heard of this thing, is basically the algorithm that solves the problem of protein folding using machine learning. If you are paying attention to the news, actually just last week, the people who invented AlphaFold actually won the Nobel Prize in chemistry for essentially developing the methodologies for this thing. Okay, but still, let's be honest. In 2018, when AlphaFold came on the scene, none of us were really thinking about AI. Because remember, that's only 2 years before the pandemic. At that time, we were happy and not thinking about AI. I think the thing that really came on that made us think about AI was actually in 2022, when this thing called ChatGPT came on the scene, and essentially kind of made everybody wonder about something completely different. So, for example, I have a couple of like front page slides here of what people thought of it. The CEO of IBM at the time thought it was a Netscape moment. And other people thought, hey, could it be a browser moment or an iPhone moment? Or even in the bottom, I don't know if you probably can't see it, but that's Reddit. Somebody asked, do you believe ChatGPT is today's equivalent of the birth of the internet in 1983? Do you think it will become more significant? So how is this possible? How is this kind of superhuman technology possible? Well, maybe we should just look at an article from the journal, from one of the scientific articles, and see how one of these AI methods is done. Okay, so again, this is a grossly simplification probably of what the actual process involved, but it offers some kind of paradigm. Okay, so the article that I picked is from Central Algebra because I'm the head of Algebra, that's our journal. And this article is on developing an artificial intelligence-based clinical diagnostic model and its utility to specialist diagnostic accuracy. Okay, so not that difficult to understand, really. The goal is pretty straightforward in this article. The goal is that given some clinical input, these people want to build an AI model that diagnoses headaches. Okay, all right. So, so how do they do it? I'll give you the simplified version. So the first step is, well, in order to train a model, you need some kind of input. So for these people, the input is, again, I have no relationship with this study, by the way. So the input here is essentially a clinic diary or clinic questionnaire. So for example, on the right side, you see it says age, sex, frequency of headache, how what the headache looks like. So that's their input. Okay. So then once you have the input, you want something, you want results, so you gotta have an output. So here's the output. So what is the output? Output is essentially one of these 5 diagnoses on the right side. So for example, perhaps the output is like a diagnosing migraine and medication you set it. Second one is tension type headache, trigeminal encephalgia, blah, blah, blah. So in this data set, what they did was the headache specialist essentially maps every single one of the inputs for one of those 5 outputs. So this input to output mapping of the data set essentially form the data in which people train things on. Okay, so then once you have this data set, you want to kind of make a generalizable model. You want to make a model from it. So how they do it? Well, what they're supposed to do and what they did do is essentially split this data set into a training data set and a testing data set. So what they usually do is they train the model on the training set, and then they'll test it on the validation set of the test set. And in some sense, this is why we call it science, because the former part of it, the training part, is essentially a hypothesis, and the testing part is kind of like the proof that it works. Okay. So then comes the magic. The magic is essentially them putting this whole data set and train it on a bunch of machine learning models. Okay, so in this case, it's on the right side. There are a lot of them. They just kind of throw it in there, see which one comes out to be the best. It turns out the light gradient boost machine is the best one. Okay, so this is the part of the magic that we were not able to do before early on in the artificial learning history. So we have a lot of these models. We have a lot of these techniques, and we thought about a lot of these techniques before. We certainly there are advances since then. But the thing is, we weren't able to do a lot of them because we didn't have the hardware capability to actually implement them. There's only when a specific thing called a graphic processing, the GPU came on the scene, that we were actually able to implement some of these. And that's essentially, in some sense, what drove this kind of AI revolution. Okay, fine. So we trained this on this model with this high-power data science tool, and then now they have to prove that. Great. So what they did is they essentially just run it the model on the validation sample, and then they kind of figure out what is best and what's not. So the way that they do it is based on this graph on the right side. It's this funky one, the curve. So that's essentially a sensitivity plotted against 1 minus specificity. So the closer this curve to the left upper corner, the better. And so you can tell that they did a really good job. And so that's really it. But obviously, this is not just everything that's in data science, right? There's a lot of nitty-gritty that we have to cover. For example, in order to actually do this, you actually probably have to clean your data really well. You have to figure out what kind of variable this actually works. You have to pick the right parameter, et cetera, et cetera, et cetera. So it's not. This is a simplified, dumbed-down version of what things are now. So in general, the method, the traditional data science method now, you have a large number of human-defined input output. You split this into testing and validation. You put a model on the testing data set, and you pretty much make sure it works on the validation set. Okay, so fine. But what is the secret history of AI in medicine? So I don't have a lot of time. Well, I'm kind of a democratic kind of guy. So I think people kind of already tell us what the secret history of AI in medicine is, and that is the Netscape moment. So it is essentially comparing artificial intelligence to the birth of the internet. So I thought to myself, well, that's interesting. How about we go back and look at the birth of the internet on PubMed and think to ourselves, how did people think about the internet back in 2005? And how does that actually become, how does that relate to the thing that we have today? Well, if you start looking at these articles, it's actually kind of interesting because we all know about the internet. So what are people talking about it? Well, the first one, we'll start off with a bang. The first one is this one with by Edward Westberg. The basis for using internet to support the information needs of primary care. This is a literature review, okay, done by JMIA in 1999, so 25 years ago. So what did he think? What a conclusion of internet. I'll read it to you. It says, indeed, this is his conclusion, critical evaluation of the representation of health information on web is warranted. The web's rapid growth and lack of control have led to numerous criticisms, including poor organization, questionable validity, and questionable reliability. These shortcomings effectively render a substantial amount of web information unsuitable for direct clinical application. All right, fine, harsh words. So then I found this article by Rima Styra in the Canadian Journal of Psychiatry, and I'll just read you the beginning of this conclusion that she found. The internet has accelerated psychiatrists' access to new research findings and other information pertinent to clinical practice. It has eliminated distance barriers and offers psychiatrists and general public equal access to scientific articles, clinical trials, and guidelines. The literature shows that general public is using internet to obtain information and, to a lesser extent, to communicate with healthcare professionals. In terms of healthcare outcome, the effectiveness of patient online access to information is still uncertain. Further research is necessary. Also, 2004. Okay. quickly, we came up about the next article, which is the blunt one. So, representation of medical information with informatics in Wikipedia was perspective in 2005. I'll read the highlighted portion. Yet, medical informatics is not represented sufficiently since a number of important topics is missing. We're not happy with that. The medical informatics community should consider a more systemic use of these techniques for disseminating knowledge about the specialties for the public as well as for internal and educational purposes. Next slide. Awesome. Finally, as a summary of all these articles, Haruko Akatsu in 1998 wrote pretty much a summary of what we just read. In its current state, however, the internet abounds with misleading information, making it difficult to sort out what is meaningful and accurate from among thousands of electronic phenomena. In other words, remember the first time you used Wikipedia? So remember way back when you first used Wikipedia, your friends tells you, hey, you kind of really have to take this as a grain of salt. You kind of should make sure your information is correct, or maybe like you should look it up on something besides Wikipedia. And then maybe you also got in a fight with somebody on Wikipedia, with your favorite tech page that you said is correct and other people said it's not, and you had a fight over it. Well, if you don't remember, I'll give you a little story. A few weeks ago, I had the thought about reading about this historian, Johann Huizinga, who's a Dutch historian. And I was thinking to myself, I wanted to read about a thing called historical sensation by this author. So, but I usually don't know much about him. So I thought to myself, maybe I should do some research and figure out which book of his I should read. So I did the right thing as I went on Meta AI, which is the Facebook version of ChatGPT, and I asked him, where is historical sensation by Huizinga developed? Now, admittedly, that is a pretty poorly worded prompt. I could have added more information there. But AI Smart, they figured it out. This is what they say. Historical sensation is a concept developed by Johann Huizinga, a Dutch historian and cultural theorist. In his book, The Waning of the Middle Ages, 1919, specifically, Huizinga explored the idea of historical sensation in chapter 1, the problem of historical sentiment. Okay, great. Very clear, to the point. I just have to find this book, Waning of the Middle Ages, read the first chapter. Okay. So if you are following my talk right now, you're probably thinking to yourself, oh, there's got to be something that is incorrect in the statement. That's why he's using this as an example. Right? So as a test, can you figure out what is wrong with this response by ChatGPT or Meta AI? Well, I couldn't. I couldn't. So I actually did not even suspect that there was an error. So I went out and looked up The Waning of the Middle Ages by Johann Huizinga. So Johann Huizinga had written this book, and there are actually two translations. And I put both the first page of the translation on the left and to the right. And the thing about it is that chapter 1 of Waning of the Middle Ages, according to one translation, is called The Violent Tenor of Life, and in another translation is called Life's Fiercest. Very different than chapter 1, The Problem of Historical Sentiment. In fact, Johann Huizinga, I later found out, did not even develop the idea of historical sensation in Waning of the Middle Ages. It comes later on in another book of his. And of course, this is a well-known problem in AI. This is a well-known problem. And in fact, it's a well-known concern to people with Wikipedia's generation. People have written articles on this. In JMIR, there's this article that says, very strongly worded, artificial intelligence can generate fraudulent, authentic-looking scientific medical articles. Pandora's box has been opened. Okay, wow, all right. But maybe more even-handed is Scott Monteith's article in the British Journal of Psychiatry that says artificial intelligence and increasing misinformation. And this is what he wrote. And I think this is a pretty good summary of our sentiment when we read this. So incorrect output from generative AI model often seems plausible to many people, especially those unfamiliar with the topic. The major problem with generative AI is that people who do not know the correct answer to a question will not be able to tell if the answer is wrong. Human intelligence is needed to evaluate the accuracy of generative AI output. Although generative AI products are improving, so is the ability to create output that sounds convincing but are incorrect. Many people do not realize how often generative AI models are incorrect. People are unaware that unless they're experts in the field, they must carefully check the answer to the question, even if the text sounds very convincing. Okay, here's another article by Maxwell Smith on AI and ethics in radiology. Recently published in Journal of Medical Imaging and Radiological Sciences, in which essentially kind of put this even on the ethical layer, this problem. And this ethical problem is the black box ethical problems. So I'll read it to you. The key ethical consideration raised by the prospect of AI technology used in medical radiation science is the degree to which clinician can trust information generated from these technologies. This use what is commonly referred to as the black box problem associated with deep learning. I inserted something about deep learning there, which refers to the fact that such systems are often able to provide an audit trail for how a conclusion or recommendation is reached because of its convolutional nature. Therefore, if used in the context of medical radiation science, some degree of trust by a clinician is required that the deep learning network is accurate and, in turn, should inform clinical decision-making. This reliance on the technology to supplement decision-making may pose a problem for clinical buy-ins and uptake of the technology. So, okay, fine. So if history is repeating itself, can we look back in history and ask ourselves how did other people tackle this before? Well, here is Haruko Akazu again, when he was all upset in 1998 about misinformation in the internet. This is what he wrote. He wrote, there are no real rules or peer review standards regarding websites, and there appears to be no reasonable way to control the vast majority of the sites with potentially misleading medical information without infringing on free speech. One workaround is to rely on master lists, or websites containing lists of trusted sites that are maintained by trusted organizations or individuals. And here is Rima Styra, back in 2005, I think, who wrote the same thing, or similar things. Like it or not, it appears that the general public is using the internet to obtain information, healthcare information. Increasingly, psychiatrists will have to take on a mentorship role with their patients to provide assistance and guidance in accessing psychiatric information on the internet. What's she saying? Should we be mentors to our patients for AI consumption? But that was 20 years ago's advice. So hindsight is supposed to be 2020, right? So let's have some hindsight. How are we doing in terms of misinformation on the internet? Did those advice work for us for the internet? And can we translate those advice into our current age to the AI? Okay, so we just, we're not only caring about data, misinformation. We also care about data security. And this is what Haruka Sasu wrote way back. The issue of privacy and security on the internet, which have received much media attention, are particular relevance as hospital physicians contemplate providing internet access to patient data. The potential benefit of such access to the medical community are significant, but the potential risk of greater concern. And then here is Rima Styra again, way back. Patients may want email contact because they perceive certain benefit from easy and almost instantaneous access to their healthcare professionals. In terms of legal precautions, email do form a permanent record that can be printed, easily forwarded to one or more people, intercepted, rerouted, or read by unintended recipients. That was about the email. But this is about AI. So this page, I highlighted 3 things from the media recently that's somewhat of the same concern. So the first one is way on the left side, is about the Hollywood strike, writer's strike. Remember that in September last year? So they want a huge deal where the AI is not supposed to be the writer of a specific article unless they're part of it. So the writer is actually the true writers. But in this article, a deeper concern is how are people using AI or material that writers have already written and use that to train their AI algorithm in the future. In the middle, this becomes more obvious when New York Times starts suing OpenAI and Microsoft. Mostly to make a point. Essentially, The reason is that they allege that Microsoft and OpenAI have essentially taken New York Times content and used that to train their algorithm without New York Times saying okay. And then if you want to go a step further into healthcare, we have this article, AI lawsuit against insurers seem to raise the health litigation. So allegedly, what happened is that people are worried, or people are suing because healthcare insurance company are using artificial intelligence to essentially deny people's prior authorizations. Allegedly, okay? All right, we'll come back and hop the lawsuit. Okay, all right. Okay, so if you go down to the fundamental thing here, really these are all about who owns the data, who has the data, and what can you do about this data. This is a more contemporary from the British Journal of Psychiatry, the one about AI disinformation. This kind of highlights it. In addition to accuracy, reliability, bias, and toxicity, there are many subtle ethical and legal questions related to generative AI. The privacy issue related to the collection and use of personal and proprietary data for training models without permission or compensation. There are also legal issues that include plagiarism, copyright infringement, and responsibility for error and false accusation in generative AI output. And this probably summarizes it even better, and I think this is actually really pointing to get at the concern that we care about as healthcare providers. Is Maxwell Smith. AI is predicated on gaining access to large data sets of health data. As Jamaica had suggested, privacy concern at the clinical level include whether patient 1 knows the extent to which their data are undergoing secondary use, 2, which portion of the data are involved, 3, who can access their data, 4, the extent to which data anonymization is effective and complete, 5, whether data could potentially be used in a way that's harmful to them, 6, whether their data are being used for financial benefit of others, and 7, whether a change in the data privacy policy in the future will affect the care they receive. And eventually, the collection and use of patients' data for these purposes also clearly implicate questions of informed consent. So, if internet is a history of AI, fine. How are we doing in terms of data security on the internet? I think we all know the answer to that. Can we translate the same strategy to AI that people have to use to counter internet security? And finally, writing in AI. So well, here I have 3 different examples of writing in AI. I think the first one is pretty obvious to everyone, is that you can actually write your thesis with ChatGPT. That book is not actually telling you to write your thesis with ChatGPT. That book is actually talking about record and stuff like that. Okay? And you can also write your grant with ChatGPT. Okay, right. Okay. The thing that maybe some people don't know is you can actually write your codes with ChatGPT. And actually, in fact, we have done this, and it's a very efficient kind of way of writing algorithms. Before ChatGPT came to see, this thing called GitHub Copilot has already been used to write codes. So to start this topic, I'm going to quote from my actual classmate, Eric Orman, although I have no connection with him writing this article in neurosurgery. And he wrote an editorial on chatbots and generative AI. And this is what he says. Human authors, with some degree of nuance into every written sentence, some are pure declarative statements of fact that have little, and some are interpretations of data that have almost all nuance. Readers rely on this to make up their own minds on the importance and value of a manuscript message. Well, an AI that did not do the surgery, did not manage the complication afterwards, did not speak with the family for weeks, but did not see the variability within the collection of 50 aneurysms that make up the report, to be well positioned to convey what the author truly means. So this secret history actually of writing in AI actually doesn't go back to the internet age. I contend this goes back to the invention of writing. So here's Plato's Phaedrus. Plato obviously lived a very long time ago. And this is a story he kind of basically made up to talk about essentially writing. And I'll get into it. At the Egyptian city of Naucratis, there was a famous old god whose name was Thebes. And he was the inventor of many arts, but his great discovery was the use of letters. Now, in those days, the god famous was the king of the whole country of Egypt. To him came to loot and show his invention. This, said the root, will make Egyptians wiser and give them better memories. It is specific both for the memory and for the wit. Thales, the guy you talked to, replied, "Oh, most ingenious Louis, this discovery of yours will create forgetfulness in the learner's souls, because they will not use their memories. They will trust the external written characters and not remember of themselves." Oh, the specific which you have discovered is not an aid to memory, but to reminiscence. And you give your disciples not truth, but only the semblance of truth. They will be hearers of many things, and will have learned nothing. They will appear to be omniscient, and will generally know nothing. They will be tiresome company, having the show of wisdom without the realities. This is from Socrates from Plato. So, a couple of comments on this. Remember, Platonic truth is actually not what we think is truth, at least our concept of truth. Platonic truth comes from the word Greek, aletheia, means unforgetting. So, lethe is the river that everybody in Greek myth is supposed to pass through so that they forget their life. And aletheia is the unforgetting of that. So, Platonic truth, so that's why you can imagine Plato having a little bit of problem with writing, supplementing it. Writing is problematic and then it allows truth to be supplemented. But despite the way that we think, we may not buy Plato's way of looking at truth. I don't think we think of aletheia as truth. The idea that something becomes missing, maybe it's truth. In AI writing, is not so different from Orman's editorial. So, what can we learn from the birth of the internet? Or the birth of writing, actually. So, I am not an AI economist, I just wanted you to know. But this is what I think. I think the issue we care about for the internet is the same as the issue we have with AI. If so, the problem is not AI, but the fundamental relationship that we have with emerging technologies in general. Especially if that technology is one involving communication. For example, like Facebook, like Twitter, like TikTok, like Reddit. In fact, I think the issue we have with internet has not really resolved, actually. Like misinformation, data security, plagiarism. These things are still alive in the internet age, in the birth of the internet that people care about. We still have them today, but we're just more used to it. And then we're just used to dealing with them for 20 years. It kind of just becomes like a thing. I wonder if this is going to be our relationship with AI in 20 years. And finally, maybe I should get on an optimistic note, is that despite all this platonic paranoia about writing, thousands of years later, writing is doing okay. Like if we lose truth of some sort in a platonic way, perhaps we have since reclaimed some of it through writing and with writing. So I guess the bigger question is actually this: how do we reclaim truth, what we consider truth, that may be lost in an era of AI? And how do we make AI our new kind of writing? So I guess this is the summary. Our problem with AI is not about specific technology. It's really kind of a human condition. And we always say that hindsight is 20/20. If the birth of internet provides us some sort of hindsight, well, what does that tell us about AI? That is.
All right, thank you, Dr. Zhang.
Wonderful talk, wonderful talk. Any questions?
Thank you for the talk. Appreciate as a physician, how we handle the AI and the HIPAA compliance, because that's the ones we challenge, including our internal. We always have debates. We should use the AI, but thank you.
Thank you. So how do we handle AI and HIPAA compliance? I think actually, I guess that's the problem, right? I mean, in some sense, this talk is not to provide an answer; it is to provide a problem, problematic. In my organization at BI, for example, people's data are not necessarily used to train. They're not allowed to be trained for AI algorithms until they're filtered and screened out. I think really the right, I mean, this is an answer at all. I think the right answer is that there needs to be a dialogue that worked out between multiple parties so that they can come to a conclusion of what to do about it. I think the thing is that is how we should tackle policy in this area in general. We should open the floor. We should involve multiple actors who are involved and have them essentially come to a conclusion, like we always do regarding these kind of policies.
Thank you. Great seeing you again, Phil. Again, the lecture as always, Tony Wong. We're from the Chinese American Neurology Association, and Phil gave a lecture last year. So I found your quote of the Plato and also Socrates fascinating, and about the truth, the definition of truth, especially in this day and age when alternative truth has been thrown around, not only in the political arena, but also in our daily lives, right? So in the past, we already knew that, seeing is believing, and, what we see is the truth, right? But on the other hand, we only see, as humans, 5% of the matter around us, when 95% is dark matter. Right, so how do we define the truth in the case of astrophysics, whatever we call it, or AI? Right? How do you predict the AI will do in terms of our own recognition of limitation, and also the utilizing the AI as a tool? Will that cause our degeneration of our memory or communication or trust among each other or in the community? What is your take on that?
Great seeing you again. That's a huge question. Right? I think in some sense, this question has not been asked in our age only, but like ever since the time of Plato. What is truth? How do we get at truth? And what is the technology? How does technology help us to arrive at the truth? And I think in some sense, there's not going to be an answer to that for our age, just like it didn't for the ages before. In some sense. I mean, obviously, I have my own sense of what truth is, but probably you would share. I think there's also a kind of a strange dichotomy between what we think of truth and also what AI can help us to determine as truth. I was talking to my a friend, Will Redlaw. He does genetics and headaches and he basically was telling me, he finds a dramatic similarity between genetics, we use genetics in AI in genetics, and also AI having a revolution like that. So I was like, wait, I didn't realize that you can use AI in genetics. And he was like, yeah, of course. Except the problem is this. Remember like how your gene sequences is basically a language, right? Just encoded in HTTC, that's it. But the problem with that is that unlike normal AI training where there's ground truth, so to speak, there's actually not such a ground truth when you're trying to use large language model in genetics. Because there's ground truth. That is actually that's how the power of using AI, a language model in genetics, is actually strangely connected to the fact that there is no ground truth in it as well. So I think in some sense, yeah, we're going to keep on facing this problem just because we're human beings. And we're going to have AI related, and now we have the corporate AI legislation.
Thank you, Phil, for always so enlightening talk. And since you came to our department to give the grant round. I have more practical questions instead of, I think we're so many philosophers here, right? Talking about AI, talking about the truth, talking about the life. The practical question is, what do you think about the physician office, using AI And well, we're learning about AI and start to use AI. There's fears as well, whether AI going to replace physician. And that's, I mean, I'm optimistic. I don't think that will happen. I think that AI will be a tool to help us to be more efficient, to be a more efficient, more informed physician. What do you take on that?
Yeah, so thank you for the comment. Yeah, so actually, I'll just talk about my field because I'm a head of doctor, and that's a bit easier for me to reach in terms of my knowledge space there. So actually, it is very easy to create an AI algorithm, maybe not even AI, but just a mathematical algorithm, to kind of be able to extract from patient data and then make a diagnosis based on the international criteria of what people have said. This is like easy to be done, and you don't even need much technique to do that. But I find that even if you have this tool, you actually cannot be substituted. And the reason for that is, as a headache doctor, I think most people, I don't know, I think people tend to think of headache as, oh, we have this list of this information. And once we get this information, we can, bam, get to a diagnosis, and that's the hard part. I think the hard part is not that. I think the hard part is actually getting the patient to tell you the accurate information. Because if you hand the patient a headache diary and have them fill it out, they're going to fill it out for you all wrong. And I thought that this is just my own take until I review an article, which is published. You said that, like this is in Germany, I think, that they took a whole bunch of people and they give them a headache diary. And then in comparison, they also called them. And then they're trying to figure out what is the correlation between the headache diary and the actual diagnosis by the phone call. And there's a dramatic difference between the two because the phone call is more accurate. So, okay, fine. So then I told my wife this, I was like, oh, this is amazing. And she was like, well, Phil, you didn't think that talking to the patient actually mattered? Like, what is this? This is pretty obvious to you, right? So I think there is a human component of dialogue that is necessary in order for us to make a diagnosis. And we tend to think of the science portion as directly translatable, but it is actually that human interaction that is the most valuable part. And it's not just compassion. It is the fact that we are human beings with each other, and that through that dialogue, we can come to some sort of quote-unquote truth regarding their condition. I don't know if that answers your question.
I'm a nephrologist and I'm very interested in AI in medicine. The thing is, I found that since AI is based on learning from languages, I found that language is also very biased. They make us humans, and also that's what makes us who we are, right, culturally and stuff. So I think English versus Chinese versus like British or Russian, inherently certain languages, certain phrases are born because of certain biases or certain product of their culture. Am I correct? So I'm just wondering that, given a lot of these studies, if you based on that, the collective wisdom of AI is going to be full of biases. I could see this throughout medicine, and you can apply that to Justice Department, military. I mean, just down the line. So I think it's very complicated, especially when you interpret health data, because you base it on certain things like the trials are all involved with white male sort of population. They avoid all the minorities, they avoid all the females, etc. How much can you trust that? Do they tell you that? They don't. They think that's got wisdom. That's not true. But you gotta know what it like skin color for dermatology specialty, for example. So I think it's very tricky. Then ethics, I don't think there is a platonic thing about truth, because I know they did a study where, let's say for these driverless automobiles, they did a survey where, let's say you have a choice between hitting a young person, a baby versus an old person. In Asia, they did the survey, they go save the old person. But in Western world, they say save the baby, and you could justify either way. So what is the truth? Who's right? There's nobody. I mean, depending on which cultural bias you have, right? So to me, I don't know how you teach an AI the truth, like what is ethics? I don't know. Like, it's so complicated, right?
Yeah, I thank you for the comment. I completely agree, and I think to your point, like I think this is kind of becoming a social problem now, because I think it was just like, was it 2 days ago or how many days ago that there was an article in the Massachusetts school system, apparently Massachusetts, some school system in the country, where essentially they were using AI algorithms trying to figure out which of the kids are at risk. And the problem with it is that it turns out that none of the, like, so tiny amount of the kids are at risk because they use a specific kind of algorithm. And that's actually not good because the kids who are not at risk for the AI algorithm, actually would benefit from the funding that they otherwise receive. I think that this concept of truth also actually has a real implication in real life. So remember that quote that Stein was saying, that essentially like there's a problem now if you look at radiology films and the AI tells you there's something, then you kind of have to either discount that if you really don't see it, and you can't actually get at like how the network actually generates this thing, but now you're somehow responsible for this truth. So the truth for the AI is no longer your truth. You know what I'm saying? Like, so it's kind of like a little kind of thing. But I do want to say that there is actually a counter argument to this. So one of my friend Daniel, like my last name right now, Danielle, she's at a UPenn, and so she actually studies how headache treatment with AI algorithms actually furthers the bias between socioeconomic classes or make it less. And I never would have thought this, so her result actually shows that you can actually make it less. And the strange thing, I was like, how is this? I thought this is all about bias, how you would think that it goes the other direction. But actually what happened is that, you can train the machine in one way so that the bias is incorporated into it, I suppose. But there's also probably another way to train it so that the bias is trained out. And because the machine, it doesn't really do the bias that we do, So that's just one aspect of the case. But perhaps there's hope, going the other direction.
I think when we migrating from the paper chart to the EMR, and they create some like a different level of the challenges to the different kind of the doctors. What do you think if it's going to happen, like to really kind of like, when the AI is going to go to our daily life and going to create the same disparity among the different doctors?
I think it probably will. So like, I don't know how many of you use Dragon, it's a dictation device. So underneath it is an AI thing, right? So when you say next step, it always comes out to be neck step. And there's no way to correct that except just going down quickly and making it go next step. I think it's going to turn out to something a little bit along that line. But in some sense, maybe the answer is that we probably should take up this challenge. Like that advice from Steiner was like, hey, you should probably, internet is coming and giving the patient false information. Maybe you should be their mentor in how to figure out this misinformation. I think maybe we should kind of do that when it really hits. Like maybe we should kind of mentor our patients a little bit. Maybe not like 25 minutes. Okay, but maybe like, just a couple of steps to tell them, hey, maybe you should take this with a grain of salt, be their mentor in how to address this kind of strange situations we are.
All right, thank you so much.
Thank you.
All right, any other questions? All right, okay, thank you, Dr. Zhang. Thank you so much. The talk is excellent and also make us think. All right, so I think that's going to kind of close our morning session. So what's going to happen is we're going to serve the lunch here. So the lunch will start around 12:15. At 12.